power equally divided and controlled by the majority leader and the minority leader or their respected designees. The gentleman from Missouri, Mr. Smith, and the gentleman from Massachusetts, Mr. Neal, will each control 30 minutes. The chair now recognizes the gentleman from Missouri, Mr. Smith.
Mr. Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and submit extraneous material on the bill under consideration.
Without objection.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
House will be in order. Members would take their conversations off the floor. House will be in order. The gentleman is recognized.
Thank you, Mr. Speaker. I rise in opposition to $100 billion worth of bailouts for a broken system that is fueled by Democrat mandates. I rise in opposition to subsidizing insurance plans for wealthy people. Any support of the bill ensures subsidies go to wealthy families making as much as $600,000 a year. I rise, Mr. Speaker, in opposition to using hard-earned taxpayer dollars to debel Democrats out of their own decision to make this COVID-era spending temporary so that they could give Green New Deal tax breaks for the wealthy, for electric vehicles, and solar panels. They had the option. They had the option to make permanent twice, whether it was in the American Rescue Plan or the Inflation Reduction Act, but instead they wanted to put their resources to their wealthy environmentalists. Check the math. Nearly half of all Americans get their insurance from their employer. Nearly a quarter from Medicaid, and a bit less than that for Medicare. Only 7% of the population relies on Obamacare, marketplace plans. This chamber should be about helping 100% of Americans and lowering the cost of health care and premiums, not just 70%. It is shameful, Mr. Speaker, that Democrats are only focusing on 7% of the population while ignoring the millions of working families who are struggling to afford health care. Since Obamacare was enacted, premiums have increased 80%. Since Obamacare was enacted, let me say that again. The premiums have increased 80%. Deductibles and out-of-pocket costs have skyrocketed. Families worry about medical debt. That is, those who still have access to doctors. In fact, 150 rural hospitals have closed since passage of Obamacare, and small businesses were crushed under the weight of the new mandates. Not only do Democrats refuse to fix any of this, they want to make it permanent at a cost of $400 billion. No thanks, Mr. Speaker. Mr. Speaker, reverting these tax credits back to the original structure that the Democrats designed means 93% of enrollees will still retain very generous subsidies next year. 60% of the enrollees will still have access to a plan at or below $50 a month. I represent one of the poorest congressional districts in the country, and still 99.7% of my constituents in my district, one of the poorest congressional districts, will be unaffected by this expiration. This is all about subsidizing the wealthy. So why are we even having this debate? Because Democrats chose to make these giveaways temporary. Not once, but twice, Mr. Speaker, as part of their partisan spending bills. The reason they did so was to shower the rich with Green New Deal subsidies, which they made permanent. And we reversed those in the big, beautiful bill. And here's a word you won't hear from Democrats: fraud. They forced taxpayers to pay up to $27 billion for as many of 6.4 million individuals fraudulently enrolled in the Obamacare plans. Nearly half of all enrollees, that's 12 million people, didn't even file one single medical claim, not even a prescription, all year last year. Sounds like they didn't even know that they had insurance through Obamacare, but those insurance companies were subsidized, almost half of them on the exchanges. And if Democrats think that that's not a problem, that's pretty scary. So I called on the Government Accountability Office to investigate. They created fictitious Obamacare applicants with fake documentation. 100%, not some, but 100%. Not half, 100% were approved in the first year. And 90% are still being subsidized, resulting in checks worth more than $12,000 per month going to insurance companies. One Social Security number was associated with more than 125 different Obamacare policies. One Social Security number tied to more than 125 policies. Waste, fraud, abuse. But apparently, the other side doesn't see that. They don't see the truth. In fact, more than 58,000 dead people were being subsidized according to the Government Accountability Office. In response, Democrats only bragged about higher health insurance enrollment. They're really celebrating, what they're celebrating is subsidizing insurers for people without a pulse. For Democrats, fraud comes first. Mr. Speaker, Republicans are putting real, living Americans first. We blocked illegal immigrants' access to taxpayer-funded health care benefits, then eliminated over $185 billion worth of fraud and waste in the Obamacare marketplace. For Americans who are eligible, we actually lowered Obamacare premiums and expanded access to health savings accounts, direct primary care, and telehealth for millions, including Obamacare enrollees as part of the Working Families Tax Cuts. We invested $50 billion in the healthcare needs of rural communities. We passed the Lower Healthcare Premiums for All American Act, which also lowered premiums even further, as well as provided more freedom and flexibility for healthcare access and increased competition by negotiating better drug prices for workers. Mr. Speaker, I take greater access to affordable health care any day over shoveling more tax dollars into Democrats' health care fraud schemes. I oppose this legislation and I reserve.
Gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. I yield myself such time as I might consume.
The gentleman is recognized.
This argument is about universal access. For years, the Republican leadership in this institution has attempted to avert this very moment. And for us, this is not to be about spiking the football. This is not to be about an end zone dance. This is about to declare a major victory for the American people. Despite what we've heard, they have used every maneuver and procedure to prevent the very debate that we're going to have for the next hour. All these years later, they've never even had a plan or an alternative. We can finally choose families, and they can join us today in extending the ACA tax credits and save health care for millions of members of the American family. How easily and quickly they did a massive tax cut for the wealthiest amongst us, while subsequently arguing that they could deny average men and women an opportunity for health insurance. So here we are, all these years later, as one who helped to write the Affordable Care Act. The ACA is still standing, and we will continue to improve it every single year. And when you consider now the uninsured enrollment in America is down to 6%, thanks to the ACA. If we did not do what we're about to do in the next hour, a family of four making $130,000 would see their marketplace premium go from $921 to $1,992. That would be an 18.4% increase. Our enhanced credits make sure that nobody would pay more than 8.5% of their income for coverage. Now, Republicans think that people can afford to increase premiums by 37%, and that's what they're proposing today. They said 2 weeks ago that they had a health care plan that they wrote on Friday night. As I noted at the time, it was held together by bubble gum and Elmer's glue, and by the way, we never even got to see it. If they had a health plan alternative, they should have showed it to us. Let me say this, Mr. Speaker. This is a good day for the American family. This is an important consideration for this institution. Despite repeated denials and efforts to thwart this very moment, in the next hour, we're going to do for the American family what we said we would do, and that's to extend these tax credits for the ACA. With that, I reserve the balance of my time.
Speaker, I yield 3 minutes to the gentleman from Texas, Mr. Arrington.
The gentleman from Texas is recognized for 3 minutes.
Thank you, Speaker. Look, my friend from Massachusetts talked about not seeing the Republican bill. We had a bipartisan provision in there that would lower premiums by 11% per the Congressional Budget Office, the nonpartisan budget office. This is a provision that you all supported. You all know we have to make the Obamacare market work. It doesn't work today. The facts belie that. Double premiums, double deductibles, 1 out of 5 claims rejected, limited choice. It has failed. That experiment has failed. And the only game in town that has actually lowered cost of health care, reduced premiums, is what Republicans passed out of the House. We didn't get a single Democrat to join us. Here's what I can't understand for the life of me. And I have some good friends over there. And I'm not mad, I'm miffed that you all would talk about affordability in health care and bring to this chamber the idea, the notion that you take a COVID-era program that you all designed to expire when COVID was over, that every watchdog group has said is loaded with fraud and waste. As the chairman said, Social Security numbers from tens of thousands of dead people siphoning money out of the taxpayer pocket, away from the vulnerable, and enriching insurance companies. Millions of ineligible people, billions of fraud. People are watching what's going on across the country, especially in Minnesota. How could you, in good faith, call this affordable health care and stewardship of the sacred treasure of our fellow Americans? We have a plan, it works. It's not perfect. There's some things we could work together on. But for the love of God and country, please, it's intellectually dishonest to tell the American people that this COVID-era fraud-ridden program is somehow going to make health care affordable any more than the underlying bill itself, Obamacare, which everyone knows hasn't. I said last time, I'll say it again, Ronald Reagan was spot on. Government isn't the solution. Government's the problem, and this is a case study for that. We need less mandates, less taxes, less regulations, and we need more freedom, more choice, more competition. We're willing to work with you, but this is beyond the pale, and it's audacious to call it affordable health care. I'm amazed, I'm surprised, and I encourage my colleagues to roundly, soundly stand firm and reject it. And no Republican should ever support this. They didn't support Obamacare when it was designed. They shouldn't support doubling down on a failed policy. And I encourage them not to begin now, and I yield back.
Gentleman yields back. The gentleman from Missouri reserves. The gentleman from...
Thank you, Mr. Speaker. I yield 2 minutes to the gentlelady from Massachusetts, the Democratic Minority Whip, Catherine Clark, who can stand at that microphone and say the following: Every child in Massachusetts has health insurance, and 97% of the adults in Massachusetts are covered because of the Obamacare plan.
Gentlewoman is recognized for 2 minutes.
I thank the gentleman from the Commonwealth for yielding. And Mr. Speaker, today, thanks to the persistence of the American people, because millions of constituents have called their members of Congress, shown up at town halls, shown up and marched in the streets, because of parents who spoke out for their kids, for doctors who spoke out for their patients, neighbors who mobilized together. Today, we have a chance to vote for Americans' health care. And today, thanks to the strength and unity of our Democratic caucus, the House will vote to restore the ACA tax credits. We will vote to restore the affordable marketplace plans that working people depend on to stay healthy, to live, to survive. Today, we will vote to prioritize the lives of regular people over the greed of billionaires and start bringing the Republican healthcare crisis to an end. This vote won't solve every problem the GOP has created. We still have to reverse their cuts to Medicaid and Medicare, to stop the closure of rural hospitals and deal with the maternity health crisis, and work together, yes, work together to create a healthcare system that is affordable and accessible to everyone. But today we can begin. Today, the People's House has a chance to stand with and for the people. I hope we have a strong bipartisan majority for this vote and that the Senate will immediately do the same. I yield back.
Gentlewoman yields back. The gentleman from Massachusetts reserved. The gentleman from Missouri is recognized.
I yield 3 minutes to the gentleman from Florida, Mr. Bean.
Gentleman from Florida is recognized for 3 minutes.
Thank you very much, Mr. Speaker. And Mr. Chairman, thank you for yielding time. Mr. Speaker, when your old roof keeps leaking, you can keep adding shingles to it, but eventually you must admit the structure underneath isn't built to weather the storm. So rather than double down on a problem that keeps getting more expensive, it's time sometimes to rethink the foundation. Such is the case with Obamacare. Mr. Speaker, we all remember those promises made when Obama signed the Affordable Care Act into law. If you like your doctor, you can keep your doctor. Turns out that wasn't true. It's also not true the promise made that this Obamacare will bend the cost curve for health care downward. Not true at all. Premiums for the average Obamacare plan have skyrocketed much higher than traditional inflations, leaving patients with higher costs and fewer choices. If you're just tuning in, America, to C-SPAN, you might assume that Republicans are eliminating the Affordable Care Act or Obamacare altogether. Simply not the case. The premium tax credits that were developed during COVID to subsidize Americans making more than 400% of the federal poverty level, including those making more, up to $600,000. Up to $600,000 are getting subsidized by the American taxpayers. In Northeast Florida, we call people making $600,000 rich. And that's who we're subsidizing with these and premium tax credits. I've also got a news flash for you, Mr. Speaker. COVID is over. We made these premium tax credits during COVID. COVID's over, and these subsidies should be over with it. But Obamacare will continue for those who need it. Americans making up to 400% of the poverty level are still eligible for the tax cuts. At this very moment, that's still happening. That means a family of four can make up to $128,000 and still qualify for help. So to call this, and I've heard it said a couple of times already, to call this a Republican health care crisis is fake news. There is new hope, Mr. Speaker. Instead of throwing more money away, we can have a new day for America to look at health savings account, to look at the lower health care premiums for all act. that, according to the CBO, are going to lower premiums for everybody, all Americans across the nation. It's time to give more choice and more competition. Those are the only ingredients that are going to make costs lower. We can't keep passing the same roof. Everybody has sticker shock, Mr. Chairman. I urge everybody, the right answer is to vote no on extending these horrible tax credits. Yield back.
The gentleman yields back. The gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. I yield 1 minute to the distinguished gentleman from New York, the Democratic leader whose tactful leadership has brought us to this moment, Leader Jeffries.
Minority leader recognized.
Thank you, Mr. Speaker, and I thank the distinguished gentleman from the great Commonwealth of Massachusetts for yielding and for his tremendous leadership on behalf of protecting the health care of the American people. I rise today, Mr. Speaker, in strong support of this bipartisan effort to protect the health care of the American people and ensure that we extend the Affordable Care Act tax credits to make sure that tens of millions of Americans do not experience dramatically increased premiums, co-pays, and deductibles. From the very beginning of this Congress, House Democrats have made clear that we will find bipartisan common ground with any of our Republican colleagues in order to address the affordability issues that are making life more expensive for everyday Americans, working class Americans, and middle class Americans. That's been our commitment from the very beginning. And today, we're able to take a substantial step forward to address the health care crisis that does exist in the United States of America and was made worse by the one big ugly bill, where Medicaid was cut by the largest amount in American history. And as a result of the policies that were part of that legislation, hospitals, nursing homes, and community-based health clinics are closing all across America. We've also seen an extraordinary assault on the Center for Disease Control, the National Institute of Health, on the Food and Drug Administration, on vaccine availability, on public health, and on health care of everyday Americans here in the United States of America. Today, we have an opportunity to push back against that assault and do it in a bipartisan way. That is what the American people have been calling for. Democrats and Republicans working together to address the affordability crisis in this country. It is not a hoax. It is very real. Housing costs out of control, grocery costs out of control, electricity bills out of control, child care costs out of control, and health care costs out of control. And what we do here today will not be the end of the effort that is necessary, but we can begin the effort that is necessary and extend the Affordable Care Act tax credits. Several things that were mentioned earlier by some of my colleagues that are completely and totally inaccurate. The Affordable Care Act tax credits benefit working class Americans, middle class Americans, and everyday Americans. And that's why we're waging this fight. We know that over 90% of the people who benefit from the tax credits that we're working to protect today make on average $63,000 a year. That's working class America. That's middle class America. That's the heartland of America. That's rural America. That's urban America. That's small town America. That's what we're protecting when we extend the Affordable Care Act tax credits. And this is not a partisan issue for us. This is an American issue. In fact, we know that the 10 states that will be most adversely impacted by the lapse in the Affordable Care Act tax credits are all, Mr. Speaker, run by Republicans. We're standing up for the American people. We're talking about states like West Virginia, Wyoming, Alaska, Tennessee, Mississippi, South Carolina, Texas, Alabama, South Dakota, and North Dakota, the states most impacted by the lapse in the Affordable Care Act tax credits. This is not a partisan issue for us. It's a patriotic one. and we will always defend the health care of the American people. That's exactly why. This is an important moment for everyday Americans. It's what they want to see out of this Congress, the People's House, the Article I branch of government, the House of Representatives, the first amongst equals, coming together today. Every single House Democrat and at least 10 House Republicans to extend the Affordable Care Act tax credits. Now, we believe as House Democrats that in this great country of ours, you work hard, you play by the rules, you should be able to live a comfortable life, an affordable life, live the good life. Good paying job, good housing, good education for your children, good health care, and a good retirement. Not too much to ask for in the wealthiest country in the history of the world. But a lot of work that needs to be done to make that aspiration, the American dream, the good life, a reality. And today we take an important step forward in that regard by extending the Affordable Care Act tax credits. And when we get this done and send it over to the Senate, and hopefully get it out of that chamber and to the President's desk, it will be part of our continuing commitment to lower the high cost of living, fix our broken health care system here in the United States of America, and ensure that in every single part of this country, for working class America, urban America, rural America, suburban America, exurban America, the heartland of America, and small town America, we can bring the American dream to life. We will protect the health care of the American people today, but our commitment doesn't end today. We will protect it tomorrow. We will protect it this week. We will protect it next week. We will protect it this month. We will protect it this year. We will protect it next year. We will protect the health care of the American people always and forever. And we will always fight to bring the great American dream to life. Vote yes on extending the Affordable Care Act tax credits, and I yield back the balance of my time.
The gentleman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
I yield 3 minutes to the gentleman from Texas, Mr. Moran.
The gentleman from Texas is recognized for 3 minutes.
Thank you, Mr. Speaker. I want to point out before I get to my prepared remarks that Leader Jeffries just said we need to fix our broken healthcare system. It is a healthcare system put into place by the Democrats. It is a healthcare system extended by the Democrats, and the proposal today will do nothing to extend anything but the failures of the past. It will not fix the broken system they put in place. Mr. Speaker, that's why I rise today in opposition of this Democrat discharge petition, because it is fiscally irresponsible and it fails to address the waste, fraud, and abuse of Obamacare while ignoring the real problems in our healthcare system and while ignoring the fact that these temporary COVID-era enhanced subsidies have done nothing but pad the profits of big insurance companies and drive up the very premiums that they purport to reduce. Let's look at the facts more closely. First, Obamacare has yet to deliver on the promises made to Americans over a decade ago. Since the ACA was enacted, premiums have increased by roughly 80%. And guess what? 90% of that increase has been paid for by the taxpayers. It's important to note that these premium tax credits are sent directly to insurance companies, not the taxpayers. And it's no secret why. The ACA was written by insurance companies to benefit insurance companies, and it has served to drive up their stock price by those insurance companies by more than 1,000% since the ACA came into existence. Meanwhile, families face out-of-pocket costs exceeding $20,000 a year and a 95% increase on their premiums over that same time period. Hardly a coincidence in a system designed to reward the insurers, not the patients. Let's not forget, today's proposed extension of these pandemic-era tax credits only relates to the 7% of Americans who are actually enrolled in the ACA, not the other 93% of Americans who are not participants in the failed ACA exchange. Of those 7%, roughly half did not even use their coverage once last year. Yet the Democrats want to pour more money into a failing ACA program at a cost of $400 billion. Far too often, Mr. Speaker, taxpayers have been left paying the bill for a broken system that lacks proper guardrails and has been grossly mismanaged. The ACA is just another example of this, and we should not spend more money to prop up a failing program, certainly not a COVID-era temporary program that they put in place and they, the Democrats, set to expire this year. Waste, fraud, and abuse in this program cannot be ignored. My fellow colleagues have gone over that today in large measure, but today Congress is being asked to pass a clean year extension and to continue to prop up this madness, to prop up the waste, fraud, and abuse. This cannot stand. The democratically backed big insurance business model is clear. Charge excessive premiums to get excessive profits, deny coverage to patients, and shift costs onto both patients and providers. This has to end. I urge my colleagues to oppose this measure. I yield back.
The gentleman yields back. The gentleman from Missouri reserves. The gentleman from Massachusetts.
Thank you, Mr. Speaker. It's a pleasure for me to yield 2 minutes to the gentlelady from California. No finer leader or person who was more determined to help bring us to this moment, whose fortitude helped to give us the ACA, Speaker Emerita Pelosi.
Madam Speaker is recognized.
Thank you, Mr. Speaker. I thank the gentleman for yielding and want to quote him when he said, "This is a happy day." Thank you, Mr. Leader, for making it so, Mr. Chairman, for making it so and bringing us to the floor. My remarks will be brief, an exclamation point to your beautiful comments earlier and those of our distinguished leader, Mr. Jeffries. Mr. Speaker, Reverend Martin Luther King Jr. famously said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhuman," he said, "because people can die." The Affordable Care Act, proudly also known as Obamacare, is a pillar of health and financial security for America's working families. Today we vote on Leader Jeffries' clear, common sense, and urgent bill to extend the ACA tax credits signed into law by President Biden so health care remains affordable and accessible for the American people. Every Democrat supports this bill because we believe health care is a right for all, not a privilege for the few. No family should be pushed out of coverage. And we welcome our Republican colleagues who will be voting with us today. This makes it a happy day. As we vote today, let us remember the stories of Americans we've heard across the country. Parents saying, "My baby was born with a heart condition costing millions of dollars before the Affordable Care Act." Husbands saying, "My wife was diagnosed with breast cancer and we couldn't afford it." Families saying, "Dad had a stroke and we couldn't handle the cost." That will not happen anymore because we are protecting these families in this bill. I urge all of my colleagues to vote yes and support this bill and protect health care and the dignity for America's working families, and yield back the balance of my time.
The gentlewoman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
I yield 3 minutes to the gentleman from New Jersey, Mr. Smith.
The gentleman from New Jersey is recognized for 3 minutes.
I thank my good friend for yielding. Mr. Speaker, Hyde Amendment protections need to be added to this bill. Taxpayer funds should not be forced to subsidize the killing of an unborn child by dismemberment or by baby poison pills. The Hyde Amendment was not, I say again, not included when the ACA was enacted in 2010, nor was it included when President Biden significantly expanded subsidies during COVID. It has gotten so bad, Mr. Speaker, that according to a 2025 article by the Kaiser Foundation, 12 states, including my own state of New Jersey, absolutely require all plans on the ACA marketplace to cover abortion on demand. We permit abortion till birth in my state, as do many others. That's all covered by Obamacare. The House has passed my bill, the No Taxpayer Funding for Abortion Act, on 4 separate occasions. Beginning in 2011, it's pending again in this Congress, but every time it's gone over to the Senate, it got nowhere, sadly. I remember the day, Mr. Speaker, when my friend and colleague, the author of the amendment, Henry Hyde, first learned that about 1 million children were alive because of his amendment. He was overcome with joy. He had a tear in his eye. I was there when it happened, when he found out. Knowing that 1 million mothers were spared the agony of post-abortion pain, 1 million children were alive and well, growing up, going to school, playing sports, dating, marrying, having kids of their own. Today, that number is estimated at over 2.6 million children not aborted, all because abortion subsidies have been prohibited by the Hyde Amendment in federal Medicaid programs and other HHS programs. It is time to add the Hyde to the ACA. I believe it's time as well for all of us to face the harsh reality of what abortion does to children and look beyond the slogans and the surface appeal arguments. The so-called abortion pill, mifepristone, is baby poison. It kills the unborn child by how? Starving the innocent child to death. That's its operation. They can't get food, they die. And then the body of that baby is often flushed down the toilet. We know, however, now that mifepristone is extremely dangerous to women. A big study, the biggest study ever done, found that 1 in 10 women experience serious adverse events. That's not what you hear from the abortion lobby. You hear about how safe it is. It ain't safe. And this 1 in 10. And they suffer things like sepsis, infections, hemorrhaging, and all within about 45 days. Let me also say to my colleagues, another method of aborting a baby is dismemberment. Dismemberment. It tears the child's fragile body to pieces and includes decapitation. Until rendered unconscious or dead by this hideous procedure, the baby feels pain with every cut of the knife. It is no wonder that the polling shows that the majority of Americans do not want public funding for abortion. Abortion is the polar opposite of health care. It is not health care. Another 20 seconds? 30 seconds?
30 seconds, please.
The gentleman has
It
recognized
is
for
the
another
polar
30
opposite of health care, Mr. Speaker. Unless one construes the life of an unborn child to be analogous to a tumor to be excised or a disease to be vanquished. I appeal to my colleagues, don't ignore or trivialize the battered victim in the womb. Unborn babies need members of Congress to be their friends and advocates, not powerful adversaries. Abortion violence must be replaced with compassion and empathy for women and respect for the weakest and most vulnerable. Yield back to balance.
Gentleman yields back. The gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. I yield 1 minute to the gentleman from Texas, Congressman Doggett.
The gentleman from Texas is recognized for 1 minute.
Our vote today represents hope, the hope of millions to access their family physician, the hope of for so many Americans who've wondered how they will be able to afford health care, hope that by using an extraordinary measure today in the House, we can address an extraordinary need. After 70 Republican repeal efforts, after rejecting the amendment I offered last May to retain these credits, and after delaying for months to give us the opportunity to provide this care, we are here today with hope. Now the responsibility shifts to the Senate. They need to promptly approve this measure and not attach any weakening provisions such as junk insurance and health savings accounts, tax shelters. Keep it focused on affordability, on providing enrollment periods for those who've already lost their coverage because of enormous premium hikes. And fraud which we've heard so much about, the only fraud that's been identified relates to broker fraud that Trump has made worse and Republicans have ignored. The biggest fraud of all would be replacing Obamacare with Republican
Gentleman is no
nothing
longer
care.
recognized. Gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
Thank you. I yield 3 minutes to the gentleman from Utah, Mr. Kennedy.
The gentleman from Utah is recognized for 3 minutes.
Thank you, Mr. Speaker, and thank you to my friend from Missouri for this time. As a family practice doctor for more than 25 years, I hear directly from my patients about the skyrocketing cost of insurance and prescription drugs. Americans were promised lower costs, more choices, and better care. More than a decade later, too many families are asking, what happened? Since its passage, the Unaffordable Care Act has created a subsidy-fueled illusion with spiraling costs hidden by taxpayer dollars and deficit spending. Today, many Americans have insurance on paper but still cannot afford to use it. Plans often come with deductibles of several $1,000s, meaning families pay out of pocket for most routine care. Insurance that cannot be used when people are sick is not real security, it's an illusion. Let's look at the facts. Healthcare costs have skyrocketed since Obamacare went into effect. The ACA promised to lower healthcare premiums by up to $2,500 per family per year. But since Obamacare went into effect, premiums have nearly tripled and deductibles have nearly doubled. The cost of coverage for a family of four has increased by more than $10,000. The benchmark ACA Silver Plan premium costs $346 a month in 2014. In 2026, the same exact plan costs $625 a month. The benchmark ACA Silver Plan deductible is $2,425 in 2014. In 2026, the average deductible will be $5,304, a 119% increase. That means that before your health insurance even kicks in, you'll have to incur $5,304 in out-of-pocket costs. Such deductibles leave families effectively self-funding their care despite being insured. A policy that you can't afford to use when you're sick is not a real solution, only an illusion of coverage, leaving individuals functionally uninsured. Compounding these design failures are serious fraud and enforcement breakdowns within the system itself. A 2024 GAO investigation found that fake identities were approved for Obamacare subsidies at a 100% rate. Often remaining unenrolled despite missing or falsified documentation, these Obamacare subsidies continued for these fraudulent applications. Taxpayers are left footing the bill as reused Social Security numbers, subsidies paid on behalf of deceased individuals, and billions in unreconciled payments expose a system unable to protect public funds. To be clear, expanding access to health insurance and protecting people with pre-existing conditions are worthy goals, but good intentions do not excuse bad results. So, Mr. Speaker, faced with these affordability problems, what have my Democrat colleagues proposed? Their answer has been more taxpayer subsidies to paper over Obamacare's problems. Rather than address the root causes of high premiums, they want to pour ever larger subsidies to insurance companies to mask the broken system. Extending subsidies without reform is just paying more for a broken system. I'm not going to vote to promote a broken Obamacare system. If health insurance only looks affordable when Washington pumps in billions of temporary subsidies, the law itself isn't affordable. The structure is the real problem that we need to fix. I urge my colleagues to vote no, and I yield back.
Gentleman yields back. The gentleman from Missouri reserves. The gentleman from Massachusetts.
Thank you, Speaker. I yield 1 minute to the gentleman from California, Congressman Thompson.
The gentleman from
Gentleman
California
for
is recognized
yielding.
for 1 minute.
Mr. Speaker, House Democrats have fought for months to save Americans' health care. That led to 4 Republicans working with us to bring this bill to the floor today. Yesterday, 9 Republicans voted with us to bring this tax credit extension up. Today, it's 11. They know that letting these tax credits expire will hurt the people that they represent as well. Congressional Republicans set the stage to price 4 million Americans out of health care plans that they need. Democrats are fighting to bring your costs down. If you take away the credits that millions of Americans depend on to afford coverage, families will be forced into junk plans that don't cover their needs or will have no coverage at all. And when they get sick or hurt, it will cost even more. This is a good day for Americans. It's a great day for Americans. Vote yes on this bill to protect health care for the people that we represent. And I yield back.
Gentleman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
I yield 1 minute to the gentleman from California, Mr. Kiley.
The gentleman from California is recognized for 1 minute.
Thank you, Mr. Speaker. I agree with points that are being made on both sides. The fundamental point of our side is undeniably true, which is that our healthcare system is broken and costs continue to spiral out of control. But it is also true that suddenly withdrawing premium support from 22 million Americans is going to force those folks into a terrible dilemma, either paying hundreds or thousands of dollars more so they face hard trade-offs for their families, losing their insurance altogether in a way that will impact the employer-based market of 150 million Americans, or working less in order to remain eligible in a way that will reduce their discretionary income as well as be bad for our economy as a whole. So we need a solution to this. But this bill is obviously not a solution. Everyone knows that. It's a political exercise that's been engineered by the minority leader at the expense of pursuing an actual solution. So now, once again, it's falling on the Senate to do the real policymaking. But I am heartened that they seem to be close to a deal that roughly mirrors the compromise bipartisan bill that I've offered with Sam Liccardo, that does a temporary extension with reforms and cost controls to provide runway, so then we can begin the real hard work of fixing our healthcare system in this country. I yield back.
Gentleman gentleman yields back. The gentleman from Missouri reserves. The gentleman from Massachusetts.
Thank you, Speaker. I yield 1 minute to the gentleman from Connecticut, Congressman Larson.
The gentleman from Connecticut is recognized for 1
Thank the
minute.
leader of the Ways and Means Committee and rise in strong support of this legislation. We've heard an awful lot of talk about subsidies over there. Let's cut right to the chase. It is about subsidies. You care about subsidies for billionaires, and you are willing to do it on the backs of the American people. You would rather see them, thank God for the people that are standing up on your side. They deserve the Profiles in Courage Award because they're able to stand up to a president who would rather see 15 million people lose insurance and another 20 million see their prices double. Thank the Republicans on that side for Profiles in Courage. Vote your conscience. Vote your constituents. This is not about politics. It's about people. I yield back.
The gentleman yields back. The gentleman from Massachusetts reserves. Members are reminded to direct their comments to the chair. The gentleman from Missouri is recognized.
Thank you, Mr. Speaker. I reserve.
The gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
Thank you, Speaker. I yield 1 minute to the distinguished gentleman from Illinois, Congressman Davis.
The gentleman from Illinois is recognized for 1 minute.
Mr. Speaker, in Illinois, there are 465,000 people who depend on the Affordable Care Act to acquire health insurance. For the past several years, a majority of them have used enhanced federal tax credits to lower the cost. In my district alone, 19,000 or 57% will see the cost of their policy go up $696 without the federal tax credits. In Austin, Mary will pay an additional $300 per month. On the north side, Emily will pay an additional $150 a month, raising her cost to $600 beginning January 1st. Rebecca will pay $796 a month. Totally unacceptable. All of these are too high. Let's be real. Let's make health care available to the American people. Let's pass today, not tomorrow, not the next day. Let's pass today the federal tax credits, and I yield back.
The gentleman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
Reserve.
Reserve. The gentleman from Massachusetts is recognized.
Pleasure to yield 1 minute to the gentlelady from California, Congresswoman Sanchez.
The gentlelady from California is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today in support of the many working families who rely on the ACA tax credits. Speaker Johnson should have let us vote on this bill at the end of last year. But instead of bringing down the cost of health care or groceries or housing, Republicans are focused on protecting President Trump while he invades foreign countries, builds golden ballrooms, and renames monuments to himself, all while families in my district watch their health care premiums double. I want to remind everyone, Republicans already kicked 15 million people off of their health care to pay for tax cuts for billionaires. I urge my Republican colleagues now to do the right thing and to vote on behalf of their constituents' interests. Vote to extend the ACA tax credits and lower costs for America's families. And I yield back.
Gentlewoman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri.
Mr. Speaker, I'd like to remind this body that the reason why these COVID-era tax credits expired is because the Democrats focused all their resources to help their wealthy environmentalists in permanent tax credits for electric vehicles and solar panels. I reserve.
Gentleman from Missouri reserves. Gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. I yield 1 minute to the gentlelady from Alabama. Congresswoman Sewell.
The gentlelady from Alabama is recognized.
Mr. Speaker, I rise today in strong support of the restoring the Affordable Care Act tax credits and lowering health care costs for millions of Americans. As of January 1st, more than 400,000 Alabamians face higher premiums because Republicans in this body let the ACA tax credits expire. That on top of the nearly $1 trillion in cuts that Republicans made to health care earlier this year. Today's vote represents one more chance for Republicans to do the right thing, reverse their disastrous policies, and join Democrats in making health care more affordable. Let's make no mistake, this vote would not have taken place had it not been for the relentless efforts of House Democrats and our leader, Hakeem Jeffries. I urge my Republican colleagues to vote yes to restore the ACA credits and lower health care costs. In the words of Dr. King, the time is always right to do what is right. Let us restore the ACA tax credits.
Gentlewoman,
Thank
time
you,
is
and I
expired.
yield back the
The
balance
gentlewoman
of my
yields
time.
back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
Mr. Speaker, I'd like to submit for the record a bombshell GAO report documenting evidence of widespread fraud with billions of dollars going to fraudulent enrollees, including as many as 58,000 dead people.
Without objection.
I reserve.
The gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
I yield 1 minute, Mr. Speaker, to the gentlelady from Washington, Congresswoman
The
Dobena.
gentlewoman is recognized for 1 minute.
Mr. Speaker, I rise today to express my unwavering support for this extension of the enhanced ACA tax credits. For the last year, my colleagues and I have fought to keep these enhanced tax credits, and while this vote is later than it should have been, it is not too late to do what is right for the American people. For my constituents, like Jerry, who has already seen a 60% increase in his premiums, Steve, whose plan went up by over 40%, and Mitch, who is looking at a 420% increase for him and his wife. Republicans in the Trump administration promised to bring down prices, but instead they've made healthcare a luxury that only some can afford. I believe everyone should have affordable, quality, accessible health care, and because of that, I will be voting in favor of this legislation and supporting the extension of the enhanced ACA tax credits. I urge all of my colleagues to join me, and I yield back.
The gentlewoman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized.
I yield 3 minutes to the gentleman from Florida, Mr. Herodopoulos.
The gentleman from Florida is recognized for 3 minutes.
Thank you, Mr. Chairman. I'm honored to be here this morning to talk about what is so important to all of us, and that is health care, not just health insurance. A clean 3-year extension brought by the minority would send $110 billion directly to insurance companies. As the chairman just mentioned, a recent GAO report showed that 23 out of 24 fraudulent enrollees were approved and received taxpayer subsidies directly to insurance companies. The GAO even reported that they were not required to provide documentation such as Social Security or income verification, money directly to insurance companies from taxpayers. Democrats said health care would be affordable, yet since the implementation of this bad idea, premiums are up 80%. At the same time, nearly 20% of the individual market claims are denied by insurance companies. In 2024, 87% of the revenue made by insurance companies selling ACA exchange claims came from taxpayer dollars. To quote a Wall Street Journal article, Democrats sold Obamacare on false pretenses that would make health care affordable. Let me say that again, false pretenses. Extending the subsidies would perpetuate that fraud. We passed a bill before Christmas that would reduce costs by 11%, and that was a CBO. The CBO said that, and we're not exactly the biggest fan of that unique organization. Our plan would actually fight fraud, which was highlighted in the GAO report. And finally, we would actually give choice to individuals as opposed to this one-size-fits-all debacle. We want health care, not a plan to simply fund insurance companies. And with that, Mr. Chairman, I yield back.
The gentleman yields back. The gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. Let me yield 1 minute to the distinguished gentlelady from California, Congresswoman Chu.
The gentleman from California is recognized for 1 minute.
1 week ago, Republicans skyrocketed health care costs for 22 million Americans. They chose to let the ACA tax credits expire, even though there was bipartisan support to extend them. Now, families are seeing premiums jump by hundreds, even thousands of dollars a month. That is utterly devastating, and it was entirely avoidable. Middle-class families are being forced to cancel coverage. People with cancer are going uninsured. Small business owners are being told to pay 34% more or $40,000 a year or go without care. Republicans knew this would happen, and they did it anyway. But now we have a chance to fix it. Democrats have a clean 3-year extension of these tax credits on the floor today with bipartisan support. Let's make sure families get the help they need. We must vote yes on this bill.
Gentlewoman yields back. The gentleman reserves. The gentleman from Missouri is recognized.
Mr. Speaker, I have no additional speakers, and we reserve our time.
Gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. Let me assure the gentleman we intend to keep on going here. With that, I want to yield 1 minute to the distinguished gentleman from Virginia, Congressman
The
Bond.
gentleman from Virginia is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, every day, more Americans are being hurt by the Republican health care crisis. Tax credits that help working people afford health care are vanishing. And Americans are watching billionaires get huge tax cuts while the cost of living goes up. My Republican friends knew that refusing to restore these tax credits would cause health care costs to skyrocket. But they decided to cancel work for 2 months and simply ignored the affordability problem. President Trump even called it a hoax. But Democrats put forward this bill to help the American people, and thanks to a few sensible colleagues on the other side, we were able to force a vote on it. And while Trump continues his self-dealing corruption and growing fondness for attacking foreign countries, his administration lawlessly killing and lying about the death of an unarmed woman in Minneapolis, Republican leadership in Congress had to be forced to even allow this vote. Democrats here are focused on a bill to lower costs for tens of millions of Americans and prevent many from losing health care. Life, liberty, and the pursuit of happiness, but you can't be free, it's hard to be happy, and our lives are cut short with no health care. I yield back.
The gentleman yields back. The gentleman from Massachusetts reserves.
Speaker?
Members are reminded to refrain from engaging in personalities of the president. The gentleman from Massachusetts.
Thank you, Mr. Speaker. Let me yield 1 minute to the gentleman from Illinois, Congressman Schneider.
The gentleman from Illinois is recognized for 1 minute.
Thank you. I rise today strongly and proudly supporting Leader Jeffries' discharge petition to extend the ACA premium subsidies. Just 8 days ago, President Trump and the Republican Congress let the ACA subsidies expire. Consequently, rather than working on their New Year's resolution, 22 million hardworking Americans are forced to decide what sacrifices they need to make to afford their insurance, or whether they need to sacrifice their family's health care. That's why today is a happy day. We are one step closer to helping millions of Americans afford health care. Getting to this day wasn't easy, but Democrats stayed united and stood firm. And after fighting for months, we are joined by Republican colleagues who recognize that we have a responsibility to help ensure Americans can afford to provide health care for their families. It's our job to bring down the cost for Americans. It's our job to make life better for Americans. It's our job to ensure that every family has access to affordable, quality care. Let's do our job. Let's extend the ACA credits. I urge my colleagues to support the discharge petition. I yield back.
The gentleman yields back.
Mr. Speaker, I reserve and I intend to go forward as well. Thank you. I yield 1 minute to the gentleman from California, Mr. Speaker, Congressman Panetta.
The gentleman from California is recognized for 1 minute.
For the past year, we've been talking about the danger, the damage to be done by not extending tax credits of the Affordable Care Act. Now this year, no longer is it theory, it's fact. And it's no longer talk, it's pain. Because the fact is, 20 million people are feeling the pain with their health care costs going up. Millions more are losing health insurance. And in my district, tens of thousands are going to be paying more for health care. And so today, the fact is that we can do our jobs, and rather than take health care away, we can actually help fix it. Now, I commend all of my Democratic colleagues, and yes, even a few on the Republican side that signed the discharge petition and are going to vote for this bill today. A day in a week that has been absolutely hectic. But rather than constantly responding to the craziness from this administration, by voting yes, Congress can finally focus on the substance of fixing health care. The fact is that this bill is a short-term fix for extending tax credits, but it's also a vehicle for our Senate colleagues to use so that we in Congress can provide a long-term fix to provide people with affordable and accessible health care.
Gentleman yields back. The gentleman from Massachusetts.
Thank you, Mr. Speaker. Let me yield 1 minute to the gentleman from Nevada, Congressman Horsford.
The gentleman from Nevada is recognized for 1 minute.
I rise to speak about being on the right side of history. I've taken the time to listen directly to the people of Nevada's 4th District and all across my great state. They've shared their stories, their concerns, and their fears about their health care. People like Richard and his wife who have worked to do everything right. They budgeted, they made sacrifices, and yet today they're paying $1,200 a month for health insurance, up from $280 a month just a month ago, because vital health care lifelines were allowed to expire. Richard told me that they can identify places to make cuts in their lives, but what worries him is what they'll be forced to give up. Fewer groceries, fewer essentials, fewer visits with family. Look, I get it. Some in this chamber want to make this about politics, but the reality, this is life and death. Life and death for the 15 million Americans who are at risk of losing health care, while Republicans found the time and the money to give tax cuts to billionaires, but no time to give relief to middle-class families. Thank you to Leader Jeffries and Democrats. I call on my Republican colleagues to join us, and let's be on the right side of history.
The gentleman from Massachusetts.
Thank you, Mr. Speaker. Might I inquire as to how much time Democrats have left here?
The Democrats have 10 and a half minutes at this time.
Thank you. With that, let me yield 1 minute to the distinguished gentleman from New York, Congressman Swazi, for 1 minute.
1 minute. The gentleman is recognized for 1 minute.
Mr. Speaker, everyone here knows that affordability and the affordability of health care is the top concern of Americans today. Failure to extend these tax credits will cause health insurance premiums to skyrocket all across our land. In my district, if you utilize the premium tax credits, a family of 4 making $130,000 has to pay 8.5% of their income for health insurance premiums, or about $10,000 or $11,000 a year. If we refuse to act, their bill will go to $30,000 a year, or $1,500 more per month. That's crazy. They won't even buy their insurance. As a result, it'll reduce the risk pool, which will cause everyone's premiums in our country to go up. That's why for months, the Problem Solvers Caucus have been working across the aisle, both here and in the House and the Senate, to find bipartisan solutions to this very real affordability crisis. Let's deliver a huge victory for the American people. Let's overcome the partisan toxicity of Washington, D.C., and get Democrats and Republicans, members of the House and the Senate, to work together to serve the needs of the American people. I urge all of my colleagues to vote yes.
Gentleman from Massachusetts.
Thank you, Mr. Speaker. Let me yield 1 minute to the gentlelady from the Virgin Islands, Congresswoman Plaskett.
The gentlewoman from the Virgin Islands is recognized for 1 minute.
Thank you very much. I rise in defense of the affordable health care for all Americans, even though my own constituents are not afforded the same benefits as Americans living in the 50 states. We are not part of the exchange. We have no SSI. We have caps on Medicaid in jurisdictions unlike elsewhere. If you need a clear illustration of what happens when Affordable Care Act benefits are taken away, look to the Virgin Islands and Puerto Rico, who are excluded from those. Our healthcare system is in crisis. Hospitals operate under Medicare formulas from the 1980s, with chronic shortages of supplies, medication, equipment, and staff. Patients bringing sheets and diapers to the hospital. Doctors pooling their money to pay vendors. Hospital funding gaps exceeding 34 million. More than 3,000 people losing Medicaid. Puerto Rico's capped Medicaid funding forced reliance on borrowing and debt, which contributed to their 2017 bankruptcy. The failure to extend enhanced premium tax credits has doubled healthcare costs for 20 million Americans. You don't want the healthcare system we have pass this legislation. I yield back.
Gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. I yield 1 minute to the distinguished gentleman from Virginia, as we would note, the ranking member of Ed and Labor, Congressman Scott.
The gentleman from Virginia is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, I rise in support of the bill to extend the Affordable Care Act's enhanced premium tax credits through a clean 3-year extension. Last year, the Republicans blocked the extension of these credits in the big ugly bill, With the expiration of the tax credits last month, the premium costs have skyrocketed, causing millions to lose their coverage. Now, when more people lose coverage, costs go up for everyone. Uninsured patients often delay seeing a doctor and end up needing more costly care at the emergency room, and when they're more uninsured, hospitals, especially in rural areas, face financial hardships and may be forced to close. In other words, those unpaid bills do not disappear. They're shifted onto everybody else, and everyone suffers. Today, Congress can step in to address the sharp premium increases and provide stability for working families across the country. So I urge my colleagues to support this bill and to support affordable health care.
Gentleman yields back. The gentleman from Massachusetts recognized.
Thank you, Mr. Speaker. I yield 1 minute to the gentleman from California, Congressman Gomez.
The gentleman from California is recognized for 1 minute.
Thank you, Mr. Speaker. It's about damn time that this bill is actually going to get a vote. And here's why. Because the Republicans in the summer passed their one big beautiful bill, which I'm glad you guys are not trying to rebrand anymore, that cut Medicaid by almost $1 trillion, took away food stamps, and then you refused to extend the ACA subsidies that would help, ACA tax credits that will help people in your own states. That's what the Democratic majority next year is going to do. We're going to continue fighting for our own people throughout the country. It doesn't matter if you're in a red state or a blue state. If you're hurting because of the Republican majority this year, Donald Trump has taken away health care, has taken away food stamps, has taken away opportunities. We're going to make sure that we reverse all that. And the first step is these ACA tax credits, because it's going to help working families. The party in the majority now who said they were going to lower the price of living, the cost of living failed. And now we're going to step up.
Gentleman from Massachusetts.
Thank you, Mr. Speaker. Let me yield 1 minute to the gentlelady from Illinois, Congresswoman Underwood.
The gentlewoman from Illinois is recognized for 1 minute.
I rise today in support of my bill to extend the Affordable Care Act tax credits and put an end to the Republican health care crisis. This Republican majority wasted all of 2025 by refusing to extend the tax credits in time to prevent the premium hikes that families across the country are facing right now. Costs are outrageous. House Democrats had to use a discharge petition to force them to do the right thing and finally hold this vote. We have heard a lot of confusing lies from the majority today. But my friends, the truth is that the ACA tax credits from my legislation work. They are incredibly popular, yet Republicans chose to let them expire on December 31st. Today, we have a chance to fix their mistake, lower costs, and protect care for millions of Americans. I urge a yes vote. Thank you so much to Leader Jeffries, Mr. Neal, Speaker Pelosi, and Brandon Casey for working with me on this. I yield back.
Gentleman from Massachusetts is recognized.
Thank you, Mr. Speaker. Let me yield 1 minute to the gentlelady from Oregon, Congresswoman Salinas.
Gentlewoman from Oregon is recognized for 1 minute.
Mr. Speaker, I rise today to urge my colleagues to pass this legislation to prevent families' health care costs from skyrocketing. I want to share just a few messages from my hardworking constituents who will be impacted. Kelly from Salem wrote, "My policy is going to increase from $40 to $191. I will have no wiggle room in my budget, no room for emergencies." Rachel from Amity says her plan will increase from $511 to $1,328 per month. She wrote, "We will probably choose to only insure our child. We cannot afford 25% of our income going to health insurance." And Janice from Salem said her monthly cost will go from $465 to $1,100. "I will go without health insurance if I can't bring it way down to no more than $500 a month," she says. "I am 5 years away from retirement." Mr. Speaker, these are just 3 stories from about 16,000 in my district, and there are millions just like these across our country. Our constituents are counting on this body to lower their costs and save their health care. I urge and I vote. Thank you, and I yield back.
The gentlewoman yields back. The gentleman from Massachusetts reserves. The gentleman from Missouri is recognized. The gentleman from Missouri reserves. The gentleman from Massachusetts is recognized.
I'd like to yield 30 seconds to the gentleman from Illinois, Mr. Krishnamurti.
The gentleman from Illinois is recognized for 30 seconds.
Thank you, Mr. Speaker. I'd like to rise in support of extension of the ACA tax credits. I met Shadeen Butchert in Chicago. She has ALS. Because the ACA tax credits have expired, her health insurance premium consumes the entirety of her husband's Social Security check. She will not be able to afford any health insurance to cover this incredibly distressing disease. I rise strongly in support, and I urge my colleagues to support as well. Thank you so much.
Yields back. The gentleman from Massachusetts reserves.
Mr. Speaker, I have no other further speakers other than myself, and I'm prepared to close. Could I inquire as to how much time I have?
It has 4 minutes.
Could I get an understanding from the chairman as to what his plan is?
The gentleman from Missouri is recognized.
We're prepared to close as well.
The gentleman from Massachusetts is recognized.
Thank you. Thank you, Mr. Speaker. It's too bad that we had to play this out to the anxiety and consternation of the American people. Think of what this might be like if you didn't know a month ago whether or not your children were going to have health insurance. Think of the anguish that you might feel proceeding to the holidays, not knowing whether or not that child would be able to complete the doctor's appointment that you had made for them because you didn't have health insurance. I didn't hear the other side complaining about keeping 26-year-olds on your parents' health insurance. How about the idea that in the ACA, we were able to abolish pre-existing condition for millions and millions of Americans who had been routinely denied the opportunity to access even primary care? I call attention to this because I have watched over these years how the ACA has not only become more popular, but the American people have come to expect the benefits of the ACA. This argument, for those of us who were here and participated at the time, was not really complex at all. The argument was that we would proceed on the basis of the notion of universal access, that you wouldn't have to worry that if you went to the emergency room that somehow you might be turned away because you would not been able to pay another bill. We don't get a chance on this earth to predict when we're going to get sick. That's the basis, actuarial realities of what insurance is about. Example, we don't get to buy homeowners insurance after the house is burned down. We don't get to buy life insurance after we die. The idea of what we did here was to spread the notion of risk, an entirely reasonable consequence authored by former President Obama, and by the way, the steadfast determination at that time of Speaker Pelosi. This was negotiated across the board with all members of the healthcare system, and we came up with a reasonable solution that we continue to build upon. So let me point out a couple of pretty important statistics. 4 years straight of record enrollment in the Affordable Care Act. 24.3 million Americans have now signed up. That's what we had in mind. When you look back at these enhanced premium tax credits, we keep hearing the other side say things like, oh, there's billionaires and millionaires that are deriving the benefit. JCT has said nobody over $500,000 is getting this benefit, and we're open to these conversations as you go forward as well. But only 38% of their tax cuts inure to the benefit of people at the lower end of the economic spectrum. By ending these enhanced tax credits, we will stop the Republican assault on the ACA. They have repeatedly said that they want to work with us, but there's been no effort on the Republican side to work with us on expanding and extending these tax credits. There's been no concerted effort from our Republican colleagues to really put out a piece of legislation, a tax bill that stands up under the magnifying glass of critical analysis. It's patchwork. It's announced every time we get near some cliff in the debate that somehow they've got a health care plan. We haven't seen it yet. I'm going to close, Mr. Speaker, by saying the same words I opened with. This is a most significant day. This is a happy day for the American people. Thank you for your time.
Gentleman, time has expired. The gentleman yields back. The gentleman from Missouri is recognized.
Mr. Speaker, I yield myself the remainder of my time.
Gentleman is recognized.
Thank you, Mr. Speaker. I'd like to remind the body that the reason why these enhanced subsidies are expiring is because the Democrats are the only ones in this chamber that voted for them to expire on December 31st. Apparently, they regret that vote because they focused most of their dollars to make permanent environmental tax policy in the Green New Deal. And so they are the only ones that have voted to take away these subsidies. It is laughable, Mr. Speaker, when you hear members on the other side say the Republicans created this health care crisis. Guess what? It was the Democrats who wrote the Affordable Care Act, which is being debated on the floor right now. And they are upset because as of December 31st, it reverted back to the Affordable Care Act, which they have championed, what they passed. Not Republicans, it's Democrats. So the health care crisis is clearly created by the Democrats. We have highlighted the fraud and the waste within the exchanges. More than half of the people on the exchanges did not even file one medical claim last year. But those insurance companies, they were being subsidized. And want to remind the American people that not $1 goes to them. It all goes to the big health insurance companies that have been doing very, very well, while premiums for every single American has been rising for the last decade and a half. With that, I urge this body to vote no.
The gentleman yields back.
Yield back.
Gentlemen, all time for debate has expired. Pursuant to House Resolution 780, the previous question is ordered on the bill as amended. The question is on the engrossment and third reading of the bill. Those in favor say aye. Opposed, no. In the opinion of the chair, the ayes have it. Third reading.
A bill to advance policy priorities that will break the gridlock.
The question is on the passage of the bill. Those in favor say aye. Those opposed say no. The opinion of the chair, the noes have it. The bill is not passed.
I'd ask for the yeas and nays, Mr. Speaker.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, and the yeas and nays are ordered, members will record their vote by electronic device. This is a 15-minute vote. On this vote, the yeas